Welcome to Serenity Medical Health and Beauty Spa, conveniently located behind the Premium Outlet Mall in Dawsonville, Georgia. I'm Sharon, Keating, RN, and we're in the treatment room today discussing the filler or volumizer called Artefill with a client, Vicki. Now, Vicki has several syringes of Artefill in her face already. We've addressed the nasolabial folds, the marionette lines, actually really off-label, the lips. But those of us who are over 5'0", we like to go for the permanent stuff because the lips last about a year. But anyway, we're experiencing a little bit of flattening in this area on the cheeks, and so we just wanted to give that a little bit of a lift to keep everything in place the way it should be. The nasolabials and the marionettes are looking very good. Lips look great. We addressed the lips, I don't know, a couple months ago, and so she's actually getting great tissue response from that. Now, Artefill is a product that's 80% collagen and 20% of the permanent filler component, which is a product called PMMA. It's the same material that hip replacement, all joint replacements are made out of. So the body recognizes it very well. The allergy profile is extremely low. And the main thing that someone might have an allergic response to would be the collagen, and even now with the synthetic collagens, that allergy profile is very low as well. So Vicki's had experienced Artefill before, and as we've said, and hasn't had any issue. So we're going to go ahead and inject that today. Is there any other concerns that you had, Vicki, before we get started?
No, ma'am.
Okay. Again, since we're using a needle on the face and we are up in the vascular area of the cheek, it is possible to experience some bruising, but there's great products out there that help the bruising heal more quickly. And of course, I won't be digging around, so it shouldn't be too much of an issue. Artefill is one of those niche products. And I use the term niche loosely. It's gaining a following, and so the intense feelings or concerns about Artefill as it's being used more, I think, are being assuaged. But Artefill is great. It's fabulous for the client who, like I said, is over 50. Typically, those are the clients that I have requesting Artefill, and the reason is because it does have FDA clearance for the term permanent. The PMMA does not go away. The body actually builds support tissue around it, and so you see an enhancement, and it does have a lasting effect. They did FDA clinical trials for 5 years. Now, that doesn't mean that it goes away in 5 years. We all know that it lasts longer because there's lots of women walking around out there that have Artefill in their face that look almost the same that they did as the day that it was injected. Now, we do continue to age, and again, this is just trying to counteract the effects of aging with the fat pads as they're shifting around and moving and losing volume. So it is a volumizer, but the volume, the beauty of it is mostly coming from our own tissue that's being rebuilt. So that is why someone would choose Artefill over another filler. It is a little bit more expensive up front, but the cost effectiveness over long term is where the true value comes in. That, along with the fact that once you reach your volumization, your maximum look, the place that you want to be, then you don't need to be refilling every 6 months to a year. So those are the benefits of Artefill, and we are thrilled to have this availability at our fingertips. We just completed injecting the left side of her face, and it was just this little flattened area here on the cheek. It's not as noticeable as when we get out here in the cheek area and we really do some large volumizing. I used 0.6 of a cc in this area, so it actually did take quite a bit of product. She'd really flattened out. She wears glasses, so the glasses sit on there, and she doesn't have real fleshy cheeks, and so this is where we're really seeing the volume loss is more towards the middle of the face and the cheek area. but hopefully it's visible on the camera that there is indeed a difference. And again, this is one of those subtle changes, and when we make a lot of small subtle changes, they all add up to a large impact for the benefit of the patient. Okay, we've just completed Vicky's full cheek area. It's not the cheek pads out on the bone, but the cheek area in the front of the face. Augmentation, we ended up using 2 syringes of Artefill. They're 0.8 ml each. So I went back and added some more here, and then we finished this side. This side, she didn't have as much flattening, but it did take, you know, gosh, I put at least a half a syringe, probably it was about 0.5 mLs in this area, and then came back and added a little bit more over here. So it is a subtle effect, but hopefully you'll be able to see on the after pictures compared to the first that it is just brings back that illusion to the mind's eye of the roundedness that we have with youthfulness. And we very well may end up doing a little bit more correcting before we're done, but what I like to do is just give the product a time to do its thing, meaning just see what kind of tissue it's going to grow on its own, because remember, the collagen is going to shrink and that's going to go away, and then your body kicks in and that it builds tissue around the permanent component. So that is Artefill. We can use it on any areas of the face. As far as we can see, it does not adversely affect the aging process. It just enhances it, and it makes all of us girls so happy, and we just feel better about looking in the mirror every day. So you can ask for Artefill and we'll know exactly what you're talking about, or that permanent filler if you forget the name, and we'll see you soon.